Face coverings, they come in lots of different forms, but they all have something in common. It helps make sure that we don't accidentally spread the disease from one person to another. This is the guidance that I gave New Yorkers on Thursday, and now the Centers for Disease Control have come up with the same guidance for all Americans. So I want to break it down, help people understand exactly what it means, and I'm going to do that by answering some questions that we've gotten in from New Yorkers. I think it'll help make it a lot clearer. So first of all, Rusty sends in this question. Rusty says, does face covered mean wear a mask or wear a full face covering? Thank you, Rusty, because this is exactly what people need to know. So first of all, face covering means cover your nose and your mouth at the same time, and obviously be able to breathe at the same time as well. So it does not mean a mask in the sense we've talked about so much in recent weeks, surgical masks, N95 masks. It does not mean that at all. Those are needed for our first responders and our healthcare workers. It means something you can create at home, just using things you may already have. A scarf, for example, a lot of people have those. You can use that to cover your nose and your mouth when you need to, when you're at all close to people. Now, again, if you're in your home, you don't need it. If you're just with your family members, the people under the same roof, you don't need it. It's when you think you might get 6 feet or less close to people. For example, if you go to the supermarket and you're worried you might come in a little bit closer contact, that's exactly the time when you want to have that face covering on. Now, Aaron from Brooklyn says, how do people get masks? They're sold out everywhere. Can the city send at least one per person per household? And Aaron, I understand the question, but I want to remind you, we aren't going to be able to do that. In fact, we don't need to do that because you can create the kind of face covering that's needed for this situation. Why are we doing it? Because new research makes clear that a number of people may have COVID-19 and not even know it, and it can be very, very mild for most people. We want to make sure those folks don't accidentally spread it to other people. The face covering helps reduce that possibility. So this is something you do to protect everyone else and protect the whole community, and it's simple to do. You don't need those other types of formal masks. We want those for our healthcare workers and our first responders, but anything you can use around the house that covers your nose and your mouth, that'll do fine. Finally, Vivian says, if people want to donate, including people overseas want to donate N95 and surgical masks to medical teams in New York City, can you tell us how? And the answer is yes, Vivian, thank you. And so many people are stepping up, and we need to let people know there are 2 ways to properly make those donations. Let us know about them. We'll follow up right away. And this is something we are working on 24/7 because finding those donations, getting them to our healthcare workers and our first responders quickly is crucial given what we're going to go through these next few weeks. So 2 ways to do it. Go online, nyc.gov/help now, or call 833-NYC-0040. That help is crucially needed, and thank you to everyone and anyone who can help us out right now. So thanks, these are great questions. Keep the questions coming, and I'll keep giving you answers. Thank you, everyone.